Well, good afternoon. So good to see everyone here. It's just a pleasure to be part of the panel today. Dr. Terri Clark. I'm a captain in the U.S. Public Health Service Commission Corps. So I sit here and I listen to my professional colleagues talk about the roles that veterinarians play in public health, and I'm just blown away. I was privileged to be named the 10th Chief Professional Officer for the U.S. Public Health Service back in October of 2011, so I'm still fairly new in that role. And part of my responsibility for this position, this actually secondary duty that I do as part of my professionalism as a commission officer, is promoting the veterinary category, the officers that are serving in the public health service as veterinarians, that are veterinarians. And as I learn more about their stories, where they're working in the different agencies and departments, I'm really intrigued again and impressed by the different roles that we as veterinarians play, in this instance within the federal government, all focused on public health. So when I come into this setting, I do feel like I need to at least give a little bit of a history of the Public Health Service. We're sort of the often unrecognized commission corps. So I'll give a little reminder that we have 7 uniformed services, 4 in the Department of Defense, which are Army, Navy, Air Force, and Marine. We have the Coast Guard, which is part of now the Department of Homeland Security. We have the Public Health Service Commission Corps, and I belong to the Department of Health and Human Services. And then we have a small commission corps in NOAA. So 7 uniformed services. The Public Health Service actually started in the late 1700s. It's been around for a long time. Back in the day when they started putting up marine hospitals around the different coastline areas, and they had a corps of physicians and nurses that were helping with public health. So we started at a very early age in our country. I was reading through some of the history this morning, and in fact, we started in 1798. John Adams, our second president, put into effect the Act for Relief of Sick and Disabled Seamen. That was started the Public Health Service. And in 1889, the Commission Corps, part of the Public Health Service, was actually formalized. So we've been around for a long time. And then to bring us into the present day, in December of 2006, President Bush signed into law the Pandemic and All Hazards Preparedness Act, which set forth the following objectives for the Public Health Service Commission Corps. The Corps is ready to respond rapidly to urgent or emergency public health care needs and challenges. The Corps is available for assignments that address clinical and public health needs in isolated, hardship and hazardous duty positions, and when required, to address needs related to the well-being, security, and defense of the United States. And the Corps is a resource available to federal and state government agencies for assistance in meeting public health leadership and service roles. I wanted to start out with this introduction and reminder because as a small corps, we're only 90 officers strong, but we have veterinarians serving in 10 departments and agencies across the federal government. These individuals serve in high-level leadership and management roles within the Food and Drug Administration, CDC. We have officers in the Department of Homeland Security. We have officers within the USDA Food Safety Inspection Service. We have officers at my home institute of the National Institutes of Health, and on and on. Our officers are diverse in their skill sets, and while their day job is focused on public health, every one of them, and many of them get focused into food safety and emerging diseases in FDA and CDC and FSIS, we are a deployable force that when the time comes for national emergencies, we can be called into action very quickly. We have rapid deployment forces, and most recently I've had the privilege of partnering within the DHHS to put our veterinarians as members of the National Veterinary Response Teams in roles for public health response and laboratory animal medicine, which is one of the other hats I wear. I'm diplomate of the American College of Laboratory Animal Medicine. And so, as you can imagine, in national disasters like Katrina, there were research animals that were affected, that were sitting in research organizations, sitting in service to us through research needs, that were also affected and captured in the mayhem that occurred after those hurricanes hit. And so we have national veterinary response teams available to go in and assist in disaster response, even for research animals. So I just want to start that sort of as an introduction. And also to say that my day job, I'm director of, I've moved out of NIMDS at NIH, and I'm now the director of the Office of Animal Care and Use at the National Institute of Health. And in that role, I service, well, we used close to 2 million animals in research within the intramural program last year. Again, veterinarians serving in a strong public health role for the health of our nation. And I'm going to leave it there, and I look forward to your questions.